Prabhukumar Challagali, consultant physician and diabetologist. Today, it's a sad news that we got a first case detected in Hyderabad. As a physician and diabetologist, I would really ask people not to scare for this coronavirus. There are something that we can prevent this coronavirus, which is very, very vital and very important. The spread of coronavirus is through droplets. The droplets that is coming from our sneezing, coughing, and whatever that liquidy things which is coming out from us. So we have to stop the droplets that is coming into the atmosphere, that is coming around you and in your surroundings. So basically you should use a mask on your face. This mask will help to stop the corona, to prevent to other people. This is very important, very vital. If you don't have a mask, leave about the mask. Sir, we don't have a mask with us. Now leave the mask. Use your hands while you cough, while you sneeze. Just close your hands around your nose and mouth. Just closing and also using your hand. This is the way you can stop coronavirus spreading to other people. Now, after this, what can be done? After this, when the virus is in your hands, after coughing and sneezing and the droplets on your hands, you need to just go and wash your hands thoroughly with soap water. If you have a facility of using a sanitizer, use a sanitizer and wipe your hands completely all around, not leaving any area. Kindly remember, use the sanitizers. If you don't have sanitizers, go and wash your hands with normal water for about 2 minutes using a soap. Constantly rub and use all around your hands, not just a side or use completely all your hand and wash it properly and thoroughly. This is very, very important. Rub thoroughly each and everywhere, every side of your hands and fingers. You should keep your fingers used to wash your hands. In between the fingers also you should clean it properly so that the virus will die and go away. And also throw your napkins or your whatever the kerchiefs you use to keep around your nose. You keep the kerchiefs as well as these kind of masks, especially these masks. Throw them carefully away, very far from your place. And also, if needed, if you're in a hospital, put it in an incineration place where they are directly, where they're directly heated up. So use this kind of masks as well as the sanitizer so that you keep yourself safe and also you will not allow it to spread. What are the signs? How you will feel person suffering? This is a normal signs like cold and cough. You get severe cold, sneezing, running nose, throat pain, body pains, general fever. And if you have history of travel, keep it in mind, if you have history of travel, you're traveling in the airport or seaport, wherever you are, if you are feeling these kind of things, immediately report to the medical authorities because the government is already prepared to attend you. They have isolation wards. We have to be very careful in India because in the Indian great nation, we have a good density of population, a heavy density of population. We have a big density. So be careful. The density of population is very high. So in the crowded places and different places, if you just cough and sneeze, the persons who are having a history of travel from other countries, especially those 29, 30 infected countries, if they come to India with the same problem, with the same things like cold, cough, sneezing, body pains, the thermal detectors will detect you. You can take the help of the medical authorities and be isolated immediately. If you are a young person, the chance of the virus fighting with you is very less. So you take good rest, isolate yourself, take good food, sleep well cooked food, eat well cooked food and take good rest, isolate yourself, don't get in connection with anyone, inform to the medical authorities and just be isolated. That will help to not to spread this virus ahead. Especially the children and the old people are to be very careful because these people are vulnerable because of low immunity. If you have a good immunity, the virus will be dying with your immunity. Our body, when it's having a good immunity, it will fight with that virus and you will be fine. But if you are an old man or young or the children, old man and children or the people who are suffering with diseases, suppressive medicines who are taking like cancer patients, the patients like diabetes, hypertension, HIV, TB, who are immunosuppressive. These people, when they don't have great immunity, these people cannot sustain with this virus. So the young can fight with this virus and they can be safe, but the old people and the little kids and also the immunosuppressive people, immunocompromised people, they will have these problems. So these people have to be taken, great care if they get infected. So I sincerely request the people who are suffering with the normal cold or coronavirus cold or whatever it is, you just get isolated, take some rest, eat good food. Good rest will help you to come out fast. Fast recovery is expected in this way. And if you are traveling from other countries which are having already this kind of diseases, you should really immediately report to the health authorities and get isolated on your own. That will help the nation and the country. Thank you very much, Dr. Prabhukumar, Challagali, consultant physician and diabetologist.